Good afternoon and welcome to United TV and Bariatric Friday. I'm your host Kemal Erkan, and every Friday 3 p.m. We bring you real conversation around bariatric surgery, health, and wellness. Today we are going to dive into the most transformative effects of bariatric surgery, the resolutions and comorbidities, from type 2 diabetes, hypertension, sleep apnea, joint pain, and in some cases even the cancer. And the prevention of the cancer. The bariatric surgery is an extremely powerful tool in fighting with morbid obesity. Now, Dr. Irgau is going to join me today, as always, and we are going to go into the specifics of comorbidities, resolution of comorbidities after bariatric surgery. Dr. Irgau, how are you doing?
I'm doing great, Kemal. It's great to be back for another session of Bariatric Friday.
Thank you for being with us. So, Dr. Irgau, we are going to go into the questions directly so that there will be some back and forth on some of the specific conditions. But from your point, if we were to start with the basics, what are the most common comorbidities you see in bariatric patients?
Absolutely. So I like to call them complications of obesity rather than comorbidities, because comorbidities sometimes suggest that these two happen to be together, right? A person has diabetes and obesity, has high blood pressure and obesity. Mm-hmm. Really, complications is much more insightful because it tells us that obesity is actually the source of that illness as well.
Right.
The most common complications we see are type 2 diabetes, where there is difficulty in controlling the blood sugar, high blood pressure, where the pressure is too high, requiring medications to control it, high cholesterol, sleep apnea, right? One condition that some people may or may not be familiar with, which is actually a very serious condition, and it could be life-threatening as well if it's not appropriately addressed. Mm-hmm. Other problems like joint problems. And you can actually go over all the main organs of the body and you find some disease affecting that particular organ due to obesity. So obesity really is a condition that affects almost every function of our body, and it creates a disease in it. But the most common ones, the most prominently known are these ones that I mentioned: type 2 diabetes, high blood pressure, sleep apnea.
So, how does bariatric surgery lead to the resolution of these comorbidities? What's that impact?
So, it is obviously complex. You know, on the surface, we could say just, okay, well, you're losing the weight, and because of the weight loss, you know, all these things that came with the weight are going away as well. But there is more to that. Bariatric surgery is not just about getting the person to lose weight. It's also about impacting some changes in the metabolic health of the person. Mm-hmm. Okay, there is actually real impact of bariatric surgery on the function and levels of different hormones that coordinate to create metabolism, right? And this could be various hormones that are involved in our digestive system. It could be neurotransmitters and hormones that are involved in interacting with our nervous system as well. Bariatric surgery brings about a positive change in this that leads also to improvement in the control of blood sugar in the case of type 2 diabetes, in improvement in the tension of blood vessels in the periphery, which leads to improvement in blood pressure as well. Because one of the problems with high blood pressure is that there is too much tension in the blood vessels in the periphery. So when the heart is pumping blood, there is resistance. That's what creates the high blood pressure. So relaxation in those blood vessels is brought about by those metabolic changes as well. Sleep apnea is another one. For instance, sleep apnea, one of the main reasons for particularly obstructive sleep apnea is accumulation of fat in the back of our mouth that leads to occlusion of our windpipe when we are breathing at night, with our head back and with our tongue pushing into the windpipe. That excess fat creates that obstruction. That's why people who have sleep apnea kind of stop breathing for a while, because nothing goes through until they wake themselves up suddenly and then they take a deep breath.
Right.
Right. That's sleep
So
apnea. So
you said that this is because of the weight gain that they have. So the fat around the
in the back of the mouth, right?
mouth,
So around the root of the tongue. That's really the essence of obstructive
and
sleep
then
apnea.
this is with the snoring, and
Absolutely.
what you were describing earlier is when someone we see and it's kind of like we make fun of these things, but these are important chronic problems, and it can actually lead to a lot of complications like the sleep apnea itself, right?
Oh, absolutely. Absolutely.
So, and then when they kind of like snore, and then they're at going kind of like the good rhythm, they're snoring, and then all of a sudden
They
it
stop
goes
breathing
up
for a
and then they
while, and then
stop.
suddenly, yeah,
That's the time where they actually stop breathing.
absolutely, absolutely.
And this is why also it's important for patients to be treated for sleep apnea while they're going through the process.
Absolutely.
Because if the body is not able to wake itself up, which our program doesn't, promote narcotics as much as possible, so these things can interfere with the patient's awakening and how they're going to respond. So these things can become a big problem. But from the comorbidity or just the disease itself, the sleep apnea can lead into a lot of other problems.
Absolutely, absolutely. Many years ago, when I was in medical school, you would hear reports about somebody dying in their sleep, right? And the most common diagnosis that people would assume were, oh, they had a heart attack when they were sleeping. Well, maybe. Or maybe they had sleep apnea and they failed to wake themselves up, right? And that can happen. Or sleep apnea by itself can create so much strain on the cardiovascular system that they can actually have a heart attack as well. I saw a patient for a non-bariatric problem in my office the other day who happened to have obesity as well. And I was talking to them, and they were sitting on the examination table. They were falling asleep. And I could tell immediately that that person has sleep apnea. And I asked them, you didn't sleep well? And they said, you know what? I feel like I go to bed, but yet I wake up and I'm always tired.
Mm-hmm.
And I said, you should have a sleep study done, because the most likely reason for this is that you have sleep apnea. Because what happens with sleep apnea is not only we have these movements of not breathing, but also our sleep is not restful. So most people who have sleep apnea, they're very tired during the day. In fact, many companies that own trucks demand that their drivers have a sleep study,
Right.
because that they're worried that they may
Safety.
fall. Absolutely, they may fall asleep on the road, which would be very, very dangerous indeed. So sleep apnea is a very common complication of obesity, and many people don't realize it, but it could be a very serious problem.
Absolutely.
And yet the solution is something like bariatric surgery, where the weight goes off, and it's actually one of the comorbidities that we see resolved almost completely after bariatric surgery.
Well, in terms of the most dramatic impact and most, or maybe most immediate improvements, which comorbidity do we see that with?
Probably the most dramatic we see is with type 2 diabetes. In some people, not everybody, but in some people, the blood sugar can become normal right after the surgery, after gastric bypass, for instance. Dr. Walter Poirier, who is one of the pioneers of bariatric surgery in this country, he wrote an article over 30 years ago now, and the title of the article was, "Who would have thought a surgical procedure leads to complete resolution of type 2 diabetes?" And in that report, he showed that he had patients. This was in the early days of bariatric surgery, when bariatric surgeons were very, very few and in a very few selected hospitals. He has presented data where patients with diabetes would be admitted to the hospital. And in those days, unlike now, Kemal, if you needed bariatric surgery, you would be admitted 2-3 days before, and you would be in a hospital for a week or so. Right. So anyway, those patients would be admitted to hospital for bariatric surgery, and they would be on insulin. So the doctors who admitted them to the hospital, they would write an order for insulin to be administered, right? Because their blood sugar would be controlled only on insulin. So these patients are on insulin to control their blood sugar. The day before surgery, they would go on, have gastric bypass surgery, and as they recover from gastric bypass surgery in the recovery room, they check their blood sugar and it's normal. They check their blood sugar the same night, it's normal, and they're not on insulin. So sometimes the result of bariatric surgery can be that dramatic. Now, granted, this does not happen in every case, but there are cases where the results can be this dramatic. And of course, if the change and improvement in blood sugar is happening the same night after the surgery, it's happening well before the weight loss has occurred. So there is something about, particularly gastric bypass, that really interferes with our ability to produce insulin, right? That leads to this dramatic change of type 2 diabetes.
So, can we include depression in terms of the not maybe immediate, but having a good outcome on depression?
Absolutely, absolutely. Depression is an extremely common condition among patients who struggle with obesity. And obviously, the reason for it may not just be related to the obesity, but like in many cases, depression really is the outcome of many intricate aspects of the life of the person, right? It could be the result of many things that have happened or happening to that person, right? But obesity definitely plays a great deal, because with obesity, we see lack of self-confidence. With obesity, we see social isolation. With obesity, we see stigmatization. With obesity, we see difficulty in advancing in different aspects of life, right? Whether it's in school or at work or other things. So those things magnify the effects of depression. Now, when people are able to conquer obesity, finally with bariatric surgery, they become much more self-confident. They feel much better about themselves. Their relationship, self-esteem goes up, right? And all those things can improve, obviously, their mood, leading to many people not requiring antidepressant medications afterwards. So of course, it is important that when it comes to adjusting medications like antidepressants, that patients who had bariatric surgery actually do it under the care of their providers, right? Patients should not take themselves off the antidepressants just because they feel better. These are important medications that will require careful supervision in terms of decreasing them or changing them.
So, I mean, this would be kind of like a reminder for people who are watching us today. This is a multidisciplinary program.
Yeah.
So it's not just about the surgery. We understand the complexity of what patients are going through. Therefore, so many different specialties are involved. And of course, none of the resolutions, any decisions on these resolutions should not be made without the physician or the provider who are in that specialty, for sure. Now, Dr. Irgau, from the choice of surgery, different surgery types that we have, and mainly with gastric sleeves and gastric bypass we do, does that have any impact on the resolutions of these complications?
It does, of course. So it is very important to understand that different procedures that we offer in terms of bariatric surgery will have advantages and disadvantages that may be pertinent for a particular individual versus another. But when you look in general, for instance, gastric bypass tends to have an advantage over the sleeve gastrectomy when it comes to resolution of type 2 diabetes. Gastric bypass seems to be a better procedure when it comes to improvement in acid reflux, for instance, right? But then obviously that has to be tempered with the long-term implications of gastric bypass, because as we've said many times in our program, gastric bypass is different from the sleeve gastrectomy because it involves rerouting of the intestine, whereas with the sleeve gastrectomy, the intestine is left in its natural place. It's not rearranged or manipulated.
Right.
So Yes, of course, you get better resolution or chances of resolution of type 2 diabetes with gastric bypass, with the same for the resolution of acid reflux. Um, but then there is another procedure that we don't talk about very often, the duodenal switch, for instance, or short is the DS. The DS is a procedure that we don't do as much, but actually it happens to be the procedure that has the most profound effect on type 2 diabetes and perhaps the longer lasting effect when it comes to improvement in some of the metabolic health.
So, are these improvements permanent, and these comorbidities, would they come back?
So they can. They can. Just like weight loss may be something that could be reversed as well, right? We've talked about how some patients can regain weight after bariatric surgery. And it's important for us not to shy away from this topic. It's important for us to say, this is a chronic disease we're dealing with, right? We shouldn't hold this chronic disease to a different standard from other chronic diseases, which you can take care of, but they can come back again. The same thing can happen with obesity. Granted, there are many things that patients can do to make sure the weight doesn't come back, to make sure that the comorbidities don't come back. But despite their efforts, they can still come back, right? So it is much less likely, for instance, for type 2 diabetes to come back in somebody who's had gastric bypass versus the sleeve gastrectomy, where the effect on type 2 diabetes is more driven by the weight loss as opposed to the metabolism that changes after gastric bypass. Similarly, high blood pressure could resolve completely, but then 2-3 years later, it can creep up again. And there may be complex reasons for why that may be. And so you may have patients who are on very strong or multiple medications for blood pressure. They have bariatric surgery and they end up having to take no medications at all because the blood pressure resolves. But then they may find that a year, 2 years, 3 years later, they still need some degree of medications for blood pressure. They may not need as much medications as they need before bariatric surgery, but they still could need some medications. So yes, comorbidities can return. Yes, weight regain can happen even after bariatric surgery. But that's why it is so important for us to emphasize how critically important it is for patients to adopt a healthy lifestyle after bariatric surgery and to look at bariatric surgery not necessarily as a magic answer that they switch on and it does everything for itself, but as a powerful tool that they have to utilize for the rest of their life. You know, I tell my patients that if a patient is struggling for obesity and they have bariatric surgery, working out is no longer something that is optional for them. Working out is a must that they have to adapt as part of their lifestyle. In other words, if I struggle from obesity and I've had bariatric surgery, I cannot afford not to work out afterwards.
And when you say workout, we are talking about physical activity.
Absolutely, absolutely. Physical activity is critically important. If I have bariatric surgery and yes, I adopt a completely sedentary lifestyle afterwards, I'm not helping myself when it comes to dealing with this chronic disease. It can creep back up again. So there are important lifestyle changes that are mandatory after bariatric surgery so that the chance for the weight regain, the chance for some of the complications of obesity like type 2 diabetes, like high blood pressure or sleep apnea, do not come back again.
So usually somewhere in between, in the middle, I kind of insert something with the family. So, I'm close to my sisters. So the other day we had a FaceTime, group FaceTime. And last 2 weeks, there was 1 week where I wasn't feeling so great, and the walk was my regular exercise was low. The tennis was out for 2 weeks. I didn't play, so I felt like this bloating, kind of like not myself. Like I knew I needed to do something, but like just feeling it. And I told him, I said, this is almost like someone who lives on their credit cards, and then all I can do is paying the interest with the minimum payments.
That's a good
And
analogy.
if I don't make enough payments more than the interest, this is never going away. So I'm so exhausted for being careful. So this just happened last week,
Yeah.
last weekend, and
Yeah.
the idea of like that feeling,
Mm.
I'm like, look, I mean, this is, you know what I'm talking about, right? So some
Yeah. Yeah.
people, we all probably went through in that in our life at some point where you have 3, 4 different credit cards, and you spend more than your financial means, and then trying to afford it with the credit cards, but then credit card charges you 30% interest rate, and minimum payment is not enough for the interest itself, and all of a sudden
You're
you
stuck.
are done.
Yeah. Yeah.
So that's the feeling.
Yeah.
Even with my own personal journey, that's how I feel. So like this week, uh, except Wednesday night when we have the dinner with one of our other providers. You saw what I ate that
Yeah.
day.
Yeah.
So I have a little piece of meat and salad, and not a lot. So like the meat was probably this big, and salad with it, and that was it. So this morning it took 4 full days for me to feel just
Recover
okay
from
again.
that. Yeah. Yeah.
But one thing that's interesting is our body is responding.
Oh yeah.
So it's both. Like it can respond to the good and to the bad. So that's kind of like the key. Like that night on Wednesday, I didn't have dessert. Well, I can tell you, I was so close to have, but I had to fight.
Right. Right. Right.
Um,
Right.
so the reason I brought this up is because on whether or not these are permanent, what we know is the 90% of that is going to depending on how we adapt and how we keep those new habits and avoiding regaining weight. So that's kind of like the kind of like the backbone of all
Yeah.
these
Yep.
issues. So and then like again, I always show this just so that people can understand this is not easy,
Right.
and
Right.
I didn't have bariatric surgery. It's just as we are getting older, everything is slower. You know how much I eat. Most of the time, you tell me that I don't eat enough, right? Is that not the case? So
That's
it
true.
is.
That's
So,
true.
and I don't. I know I don't eat, but I still have to fight because I still have to be careful because this is it's different when Zoe was here earlier before you, so she's 19, 20. Of course, the life is great for them because their metabolism is much faster
Absolutely.
than when we are in
Absolutely.
our 40s, 50s, and 60s.
Yep. Yep.
Now, people have these complications. Almost these are like the groups of complications. They don't just have diabetes; they have diabetes with, the hypertension, and then with that, sleep apnea. And it's not like they just have one of these. There's usually 3, 4 of these together. For those patients with the multiple comorbidities, what would be the best way to approach them to pursue them to do the bariatric surgery?
So I think it is important that they sign up in a program where there is a multidisciplinary system, right? Where there is going to be the surgeon, perhaps another physician who has an interest in weight management, certainly nutritionist, psychologist, and other specialists could be involved, like an endocrinologist, for instance. That approach will not only get them to really understand the interplay between the different conditions that they have, but also how to optimize them before bariatric surgery, right? For instance, not everybody who has high blood pressure is getting appropriate medications and controlling it well, or type 2 diabetes, as you know, as we see in case conference, it's not unusual to see somebody with type 2 diabetes on medications, and yet their indicators could be very abnormal still. So the control of that type 2 diabetes is not appropriate. Or you could have somebody who may have all the symptoms of very severe sleep apnea, and yet no treatment is being rendered. So they need to come to a system and set up that recognizes these complications and addresses them appropriately to optimize them before surgery. Very often patients wonder why they need to have a treatment for sleep apnea before bariatric surgery if bariatric surgery is going to take care of the sleep apnea afterwards. But we explain the fact that it is critically important that as they go through the surgery itself, good control and good treatment of the sleep apnea is critical. Not to mention the fact that for them to have good sleep is going to be important in terms of accelerating their weight loss as well, so that their body responds well as well, right? So all these complications cannot be left by saying, okay, you know what, bariatric surgery will take care of them anyway. No, we have to optimize them. We have to recognize them, first of all. Many patients will come to us not knowing that they have type 2 diabetes, for instance, right?
Yeah,
we do tests and we find out
so
they have type 2 diabetes, and in fact, roaring severe, right, levels of A1C, right? We see
I have seen 15,
yes,
13,
absolutely.
11, very frequently 9, 9.5.
Absolutely. So you don't want to go into surgery without really having good control of this problem. The same with high blood pressure, the same with high cholesterol, the same with sleep apnea. So patients who have these problems, first of all, they need to realize that they are interrelated, right? If a patient has obesity and they are taking medications for diabetes, they are taking medications for high blood pressure, they are taking medications for high cholesterol, they are taking medication for acid reflux, they need to understand that all these problems have a root cause, and that root cause is obesity. And going to a program where there is experience not only in getting them safely through bariatric surgery, but also addressing these problems and optimizing them before bariatric surgery is really important.
Now, we talk about the resolutions, and there are so many good outcomes. But were there any case where the comorbidity is worsening?
So unusual. So, for instance, it is possible to think about heartburn or acid reflux, for instance, as a complication of obesity that could get worse after the sleeve gastrectomy, for instance. Not in everyone, but we see cases where patients who've had some acid reflux that was controlled maybe by taking anti-acid medication a couple of times a week, then after sleeve gastrectomy, this could potentially become worse and requiring medications on a daily basis. Yeah, so it can happen in certain conditions, but it would be very unusual to see that with type 2 diabetes or hypertension.
I see. So I think we did cover most of our questions, and I know our people are able to watch our other episodes for this topic or the other topics that are in their specific playlist on our channel. Dr. Irgau, thank you for joining me today.
Of course, my pleasure.
This was another impactful session, and the numbers don't lie. Bariatric surgery is more than weight loss. It's about saving lives and restoring health. For our audience, if you or your loved ones who may be suffering with morbid obesity, please make them talk to their healthcare professionals, or if it's you who's having this issue, please talk to your primary care and come to us for a consult and make sure that you get the proper support that you need. So this is one of the most powerful tools in weight loss, and most effective one at the same time. So take advantage of this, and Thank you for watching us. And then until next week, stay united, please. Bye-bye. There, so you can let me know when it's time.